So as we all know by now, it was last week when President Trump was admitted to Walter Reed Medical Center to be treated for COVID-19. Part of that treatment you've heard a lot about now included a cocktail of medications that includes a dose of Remdesivir.
Yeah, which we've been hearing about for quite some time. The antiviral drug was one of the first treatments for coronavirus patients, and it seemed to help moderate their symptoms, but it's still not an official treatment for the virus. But Javi's got more on that and the fact that that could change.
Yeah, and it's already been widely used, but the European Commission negotiated enough doses for 500,000 patients in 36 countries to receive that treatment. So here to discuss that, we're joined now by cardiologist and medical researcher Dr. Ernst von Schwarz, and we thank you very much for joining us. Now, since the beginning, since we've heard about Remdesivir and it's been used, this has really been the game changer in the fight against COVID-19.
Good morning, Javier. Absolutely, yeah. The first studies were actually published in May of this year, and then 5 total studies were published subsequently. The last just yesterday in the New England Journal of Medicine, which showed that Remdesivir, which is an antiviral drug, which inhibits basically the virus to make more copies, has shown that it can shorten the time to recovery from 15 to 10 days compared to placebo-treated patients. In addition, there was a small, non-significant mortality benefit, 11% in the Verum group versus 15%. Again, that was not significant, but there's a trend. So we are using Remdesivir since several months. Initially, at least in California, it was not available, but now the FDA has supplied us with what is called an emergency use authorization for Remdesivir, initially only for the sickest of the sick patients, meaning those with proven respiratory infections needing oxygen or needing even a ventilator therapy. But as of late August, that was basically changed, that all patients with COVID-19 who are hospitalized and have signs for a respiratory infection can be treated with a drug which is not officially FDA approved, but for emergency use.
I know in the case of President Donald Trump, that was one of many medications he was given for treatment. So is this an act-alone treatment, or does it have to be combined?
Well, Remdesivir is given intravenously, so it's only for hospitalized patients, usually between 2 and 10 days, depending a little bit on the severity of the disease. But no, it's not a standalone treatment. It's done in addition to other established, more or less established treatments. Of course, supportive therapy with IV hydration, sometimes combined with antibiotics if there's a bacterial superinfection. We use also, in certain cases, steroids, which have some anti-inflammatory effects. We use in very severe cases also convalescent plasma, which is plasma from people who have recovered from the virus and have antibodies. So it's an antibody shot, if you wish. In addition to anticoagulation, meaning we make the blood thinner of those patients because we know that COVID patients have a significant risk of forming clots in their blood vessels. So it's a combination therapy, including Remdesivir.
Doctor, overall, I know this is amazing progress as we continue to learn more about the virus and we continue to fight back against it. How are we doing in the overall fight in managing the death rate?
Well, the death numbers went down, as you probably know, Javier. On the other hand, just 2 days ago, several states in the U.S. have reported higher disease numbers, so not automatically hospitalizations, but higher numbers of patients who tested positive. Just 2 days ago, it was approximately 42,000 new cases in the U.S. who tested positive for COVID-19. So the death rate overall has gone down because of more aggressive treatment. But we are all very concerned about what we call the twindemic, which is coming up, which is the pandemic of COVID combined with the flu season. So keep in mind that whenever we get a flu or any respiratory tract infection, that weakens our immune system significantly. And if we get COVID on top of a weakened immune system, that could be a disaster. And we are very scared as healthcare providers and physicians what's coming up in the next couple of months.
Always great to speak with you and get the best information possible. We thank you for taking the time